Howdy and welcome to another video edition of Remedyland. Today I want to talk to you about tooth abscess and gum abscess. Dental troubles are just about the most unpleasant situations to overcome. However, the danger they present is continually neglected and people basically regret dismissing them once the disorder is becoming considerably more serious and, consequently, more difficult to remedy. Once suffering from an abscess, the pus are going to develop in the gum but not in the bone. A dental abscess is infection of the oral cavity, face, jaw, or even respiratory tract that starts in form of a tooth bacterial infection or perhaps cavity. All these bacterial infections are typical in individuals with bad dental health and are caused by not having appropriate and regular dental care. Microorganisms from a cavity are able to expand into the gums, the cheek, the respiratory tract, under the tongue, or perhaps into the jaw. A tooth abscess could possibly be extremely unpleasant once tissues get infected. Once infection progresses into the holding structure of the tooth, it is going to cause dental abscess. This will likely consequently damage the underlying construction of the tooth, the bone along with the tissue mass. The damage can result into the development of pockets. Nutrition elements are going to collect in the pockets to create oral plaque as well as data. This generates a contributing surroundings for the microorganisms to exist and increase. Ultimately, contamination is established and pus builds up in the gums. A dental abscess or gum abscess can result in toothache as well as other indicators. Abscesses will develop in a short time. Typically they develop just 1 or a couple days after the contamination begins. If you happen to believe that you have a dental abscess or gum abscess, check a dental professional immediately for therapy. With no treatment, the problem will probably turn into more painful, therefore you could lose the impacted tooth. Additional complications are rare, however could be dangerous or even deadly. Gum abscess or periodontal abscess. A gum abscess, also known as a periodontal abscess, is normally resulting from infection in the area between the tooth and periodontal. The bacterial infection could take place after nutrition becomes stuck between the periodontal and tooth. In individuals with serious periodontal condition, microorganisms could develop under the periodontal as well as in the bone. Gum abscess could develop around active tooth. Starting from the periodontal, the pus runs on its own into the bone by making an opening in the bone around the tooth. This can sooner or later damage the fundamental bone. The condition is able to only go downhill. That's exactly why periodontal condition can never be left without treatment. Periodontal abscess frequently leads to the periodontal to get a little bit separate from the tooth. This will cause pockets to develop that might get stuffed with microorganisms and also proceed to develop an abscess. A periodontal abscess could possibly build up as a complication of damages to the gums or periodontium. A periodontal abscess is oftentimes known as a periodontal boil since the abscess triggers inflammation to build up beside a tooth. When you press the periodontium around the tooth, you can feel pain. There may exist problems in opening up your oral cavity as a result of the inflammation and swelling of gums near to your tooth. Be aware that the contamination may extend to additional periodontal zones in the event you don't obtain appropriate therapy. When you need dental emergency therapy, you are undoubtedly in the acute stage of periodontal health problem. Appropriate oral hygiene and also routine dental appointments can easily prevent gum abscess from creating. In the event that a fistula is created, your dental professional are going to trace it back to the cause of the contamination. Dentists are going to implant an elastic, slim section of substance into the fistula. This should show up on an X-ray and display the dental surgeon the location the fistula. As soon as dental surgeon clears out the contamination, the fistula generally are going to close up on by itself. Tooth abscess or dental abscess. A tooth abscess known as a dental abscess takes place inside the tooth. That'd be the case once the tooth's nerve is lifeless or dying. This form of abscess appears at the head of the tooth's root, after which it develops to the adjoining bone. Indications of a dental abscess normally come with pain, inflammation and sensitivity of the oral cavity as well as face. With the continuing bacterial infection, you could experience dizziness, vomiting, fever, shivers and diarrhea. The indications of dental abscess ordinarily include, however, are not restricted to, cavities, periodontal inflammation, oral inflammation, sensitivity with touch, pus discharge and also occasionally problems, completely opening oral cavity or perhaps eating. Find a dentist immediately. A dental surgeon are going to typically drain out the pus, which usually delivers significant elimination of problems. This is achieved possibly by lancing the tooth abscess or perhaps by drilling a tiny opening in the tooth to allow the pus get away. Occasionally, in the event that the contamination is not controlled, an antibiotic is recommended for a couple days after discharging the pus, to clean remaining contamination. But, generally speaking, an antibiotic might not be required as soon as the pus is empty. In the event that the contamination is not handled, it could harm the adjoining bone or tooth. A hollow tunnel occasionally develops via the bone and skin layers to enable pus to drain out. This tunnel is known as a fistula or perhaps sinus tract. Perhaps you may notice or sense this gap inside your oral cavity. It appears like acne. In case you have pus discharging via a fistula, you can observe an odd taste in the mouth. In the event that a dental abscess is extremely massive or perhaps the tooth is severely affected, you might need to have the tooth extracted. A massive tooth abscess oftentimes do require to be cleared. The dental surgeon creates an opening in the periodontal through the bone to provide and get out wafer liquid or pus. It will decrease the danger of additional extended of the contamination. Home remedy for tooth abscess or dental abscess and home remedy for gum abscess or periodontal abscess. Probably the most effective ways to remedy a dental abscess would be to expose it to some amount of high temperature. This can be achieved by putting a fresh, hot face towel over the boil for a time of around 20 or so minutes at least 4 times per day. Holding a couple of warm face cloths handy will help you to spin them, thereby making absolutely sure that the high temperature stays stable. Perform this remedy consistently for most beneficial outcome. The high temperature are going to take the swelling to a head. One more possibility could be to employ a dry herbal tea bag between the tooth and periodontal and let it sit at that place for a period of between 40 and 60 minutes. Make an effort putting it on the non-inflamed side and also elevate your face gently in an effort to enable the herbal tea to drench over the periodontal and tooth for additional valuable outcome. Your dental surgeon will give you a prescription for medications and painkillers. Those medications are going to help the abscess healing process and also prevent the bacterial infection from expanding. Antibiotic treatment is the most effective short-term remedy for periodontal abscess. It will be given at the time of a dental emergency. You usually will achieve relief between 1 to 2 days. I hope you've enjoyed this video edition. We'll see you again on another video edition of Remedyland. Take care.